So we start with Ayurveda and Unani medicines and practices. Uh, so first we need to know what is Ayurveda, what is Unani medicine, what are their basic principles, and what is the philosophy of this kind of medicinal or traditional medicinal practice. So both of them, Ayurveda or Unani medicines, they are two ancient systems of medicine. They originated in India and the Middle East, respectively. Means Ayurveda is originally from India. Unani medicine is originally from the Middle East. And when we talk about Middle East, it includes Arab countries and Iran as well. It's not only Arab countries. Okay, so Persia is included in the terminology of Middle East. Both of them, they have holistic approach, means they don't focus only on the body, but it's more holistic than this. Their approach to health and wellness emphasize the integration of body, mind, and spirit, as well as the use of natural remedies and lifestyle modifications to prevent and treat disease. So, for them, they recognize effect for mind condition, spirit, on the body condition. Okay, and for treatment, they don't only stop or focus on drugs, but use natural remedies. They also advise on lifestyle modifications and other modalities to prevent and treat disease. Okay, both of them, they use a wide range of natural remedies, including herbs, spices, minerals, and animal products, as well as various diagnostic and treatment methods such as pulse diagnosis. They use treatment modalities other than herbs like massage and cupping therapy, which we call it hijama. Okay. These systems of medicine have been used for thousands of years to treat a variety of diseases and conditions and are still widely practiced in many parts of the world up till today. Okay, so first we talk about Ayurveda. What is Ayurveda? Actually, this means the science of life, and it is based on the belief that the universe is composed of five elements. These elements are air, water, fire, earth, and space. And sometimes instead they call space as ether. Okay, so there are five elements in this medicinal practice. They believe that universe is composed of five elements: ether or space, air, fire, water, and earth. And then each person has a unique constitution, or they call it prakriti. So this constitution of each person is determined by the balance of three doshas. They call them vata, pitta, and kapha. Okay, so it depends on the balance between them. You will have different prakritis, different persons with different nature. Okay, some may have more of this, more of that, so they will be different in their nature. Each dosha contains different elements. Like for kapha here, it includes earth and water. For pitta, includes water and fire. For vata, includes ether and air. Okay, this is the concept of Ayurveda. Doshas represent different elements and qualities in the body. If there is imbalance of any of them, this can lead to a disease. This is their belief. It also emphasizes the importance of a healthy lifestyle, including balanced diet, regular exercise, and meditation to improve the wellness and health of the body. This is a very old system that rooted even to an ancient Vedic culture in India, dating back to over 5,000 years ago. And they have old scriptures. The earliest known texts of Ayurveda, they call it Charaka Samhita and Sushruta Samhita were written around 1500 BCE. Okay, 1500 years ago almost, or before this modern age. Of course, because the culture in India is Hindu culture, there is some Buddhism in the northeast of India. So these have influence on Ayurveda. Has been influenced by Hinduism, Buddhism, and Jainism religions, and it has played an important role in Indian culture and Indian spirituality. On the other hand, when we talk about Unani medicine, Unani actually is an Arabic word. It means Greek medicine. The country Greece in Arabic is called Yunan. So when we say from Greece, in English we say Greek, in Arabic we say Unani. Okay? So Unani medicine is actually based on the teachings of Hippocrates and other ancient Greek physicians, as well as it has been integrated also with some of the traditional medicine of the Middle East and South Asia. Okay? According to Unani medicine, the concept or the principles is that human body is composed of four humors: blood, phlegm, yellow and black bile. So composed of four humors: blood, phlegm, yellow bile and black bile. Each humor is associated with different qualities and functions in the body, and if there is any imbalance in any of them, this can lead to a disease. Same as Ayurveda, Unani medicine also emphasizes the importance of healthy lifestyle, including balanced diet, exercise, and hygiene. It's no talking about meditation here in the Unani medicine, but this is the main difference probably. Ayurveda, there will be meditation, yoga, but in Unani medicine, there is nothing like this. Mainly talk about diet, exercise, and hygiene. Okay? Actually, especially during Abbasid dynasty in the famous Muslim empire, there was a big movement or translation movement. They translate Greek science most of because we know that the Byzantine Empire originated from Greece. They occupied most of South Mediterranean countries. They formed a big empire. They also learned from sciences of old civilizations like Pharaoh civilization. And contrary to pharaohs, which used to keep science as a secret, only in the layer of priests. But for Greek, there were scientists that write books and publish books. So their books can reach to other nations, other people can be taught. So during this Abbasi time, there was a big translation movement. They translated a lot of Greek books in different disciplines of science, medicine, astronomy, engineering, many other things. And then also physician, even philosophy, and scientists at this time, they integrated the concepts from Greek with the traditional concepts they have. So this Unani medicine actually is not, we call it Unani because there are principles from Greek medicine, but it's not the raw Greek medicine as it is, but it has been developed further by Muslim scholars at this time during Abbasi dynasty, like the very famous scholars like Ibn Sina, Al-Razi. Actually, they had their own research. They discovered new discoveries in medicine, anatomy, and other branches of medicine. And they integrated this Greek medicine with the traditional medicine that already was practiced during this time in Persia and in India. Okay? So then this Unani medicine has played an important role in the development of Islamic culture and spirituality, and has influenced traditional medicine practices throughout the world. Same like philosophy. Philosophy originated from Greek philosophers. At some time during this era, Abbasi era, also has spread. Some people embraced the philosophy principles, but there was also another movement in the opposite direction, like some famous Muslim scholars, they also criticized philosophy, and so the principles are not taking as it is 100%, but also there is a criticism, there is an examination, and then only those that principles that believe to be correct are adopted. Okay. Up till today, we have some of these principles are being practiced. So the current status and relevance of Ayurveda Unani medicine, there is practice up till today. The practice is different from country to another. Like Ayurveda, for example, in India is very common. It is also there is some status of recognition. So it has have continued to be relevant in modern healthcare systems, both in their countries of origin and globally. So, but the practice may not be uh, like in India, maybe used by some people as first choice. In other countries, maybe just as a complementary medicine. So actually, they have gained some popularity and as complementary and alternative medicine. So when we talk about complementary, means that we use it besides the modern medicine. If we say alternative medicine, then we can use it instead of the modern medicine methods or practices. Okay, modern medical practices. It has been recognized by many countries as important parts of their healthcare systems, especially in India. It's being practiced, recognized as a formal healthcare system, regulated by the Ministry of Ayurveda, Yoga and Neuropathy, Unani, Siddha, and Homeopathy. Okay, there are Ayurveda colleges, there are hospitals that have been established throughout India, and many traditional Ayurvedic remedies have been integrated into modern medicine practices. You can see, like I think here in Malaysia, Himalaya company, they have a lot of products that are based on traditional Indian herbs, and they make blends of different herbs for different indications. This is very common in India. There are many products of herbal origin and being used for treatment of diseases instead of the synthetic medications. Okay. Unani medicine also recognized by the government of India and has been integrated into the national healthcare system. Okay. So the basic principles that, as we mentioned, both Ayurveda and Unani medicine, they recognize the interconnectedness of the body, mind, and spirit, and emphasize the importance of holistic approach to health and wellness. They recognize also the importance of preventing disease through healthy living practices rather than just treating symptoms once they arise. And they believe that the body has innate ability to heal itself and that this healing can be facilitated through the use of natural remedies and healthy living practices. Okay? As we mentioned about doshas for Ayurveda, they believe that every body is made up of unique combination of these three doshas, Vata, Pitta, and Kapha. And these three doshas or energies, they govern the physical and mental process of the body. Okay? They present, as we mentioned, in varying degrees in every individual. Each one has his special constitution that is called Prakriti. So, what are these different energies or different doshas and what is their effect? Actually, Vata is, as we mentioned, compared from air and space. They believe it is responsible for movement and the nervous system. So, based on the constitution, you have different types of people. The qualities associated with Vata, we can have people of dry type, light type, cold type, rough, subtle, or mobile type. Okay, so if it is balanced, then they believe it is associated with creativity, enthusiasm, and flexibility. Okay, so if there is imbalance in in this Vata dosha, then what will happen? They believe it will cause some diseases like anxiety, insomnia, constipation, joint pain, and dry skin. Okay. On the other hand, for Pitta dosha, They describe it as composed of fire and water and responsible for digestion, metabolism, and transformation. So when they describe the people according to their level of Pitta dosha, they describe them as hot person, sharp person, oily, light, liquid, or acidic. The balance of Pitta they believe that it is associated with intelligence, leadership, and good digestion system. Okay? So if unbalanced, what kind of diseases they believe that will be caused? They believe it may cause some conditions like acid, this imbalance will cause some conditions like acid reflux, skin rashes, ulcers, and anger management issues. Anger management issues. The last dosha, Kapha dosha, they describe it as composed of water and earth and responsible for stability, structure, and lubrication. So when it comes to the level of kapha energy, the qualities associated, they describe the person as heavy, cold, oily, smooth, dense, or static. Okay? If it is balanced, it is associated with calmness, stability, and endurance. If there is any imbalance, they claim that it will cause some health conditions like obesity, diabetes, depression, and congestion. Okay, so management of these any of these conditions depends on restoring the balance of the dosha that is associated with them. Okay. Then what are the different treatment modalities in Ayurveda? They have different treatment modalities like use of herbal medicines, dietary modification, as we mentioned, lifestyle changes. They use massage. They use also yoga and meditation. So when it comes to herbal medicines, they use a wide range of herbs and botanicals to promote health and treat disease. These natural remedies will be tailored to individual needs and conditions based on the underlying doshas and imbalances. Can be administered in different forms like powders, teas, tinctures, or oils, and they are believed to work by restoring balance to the body natural healing mechanisms. When it comes to dietary modifications, Ayurveda and Unani medicines emphasize the importance of balanced and healthy diet in promoting optimal health and well-being. Foods are classified according to their effects on the doshas and can be used to balance imbalances and promote health. For example, warm and nourishing foods recommended for those with excess Vata dosha, while cooling and refreshing foods are recommended for those with Pitta with excess Pitta dosha. Okay, so this is the way that Ayurveda used the dietary modification to control the excess doshas in the affected persons. Lifestyle modifications, both medicine practices believe that lifestyle factors such as stress, sleep, exercise, they have profound impact on health and well-being. So practitioners may recommend specific lifestyle modifications to promote balance and harmony, like practicing yoga, meditation, getting enough sleep, or engaging in regular exercise. When it comes to massage, Ayurveda and Unani medicines use massage as a way to promote relaxation and balance in the body-mind system. So the main indication is to promote relaxation and balance in the body-mind system. Massage techniques of Ayurvedic medicine tailored to individual needs and may use a range of natural oils and herbs to promote healing and relaxation. So the massage usually will be with the aid of some oils that may contain some herbal extracts. When it comes to yoga and meditation, Ayurveda and Unani medicine recognize the importance of mind-body connection in promoting optimal health and well-being. Yoga and meditation commonly used to promote relaxation and balance and can be tailored to individual needs based on their underlying dosha. Okay, so how to practice it? The practitioner will advise based on the analysis of the condition and what dosha have imbalance and need to be and the balance need to be restored. Okay, so these are examples of some herbal medicines used in Ayurvedic and Unani medicine. The first herb is ashwagandha. This adaptogenic herb contains compounds called withanolites that can help reduce stress and anxiety, improve immunity, and promote physical and mental performance. Okay, and when we say adaptogenic herbs, these herbs usually they have anti-aging effect, and they have anti-aging effect. Okay, and also they call it adaptogenic because it will help to adapt to stress. So adaptogenic herbs, they have two characteristics. They help to adapt with stress, and at the same time they have anti-aging effect. The other herb that is very famous in Indian medicine or medicinal practice is turmeric. And turmeric even is used a lot in the food as food ingredient, and especially in Southeast Asia and India. The active constituent in turmeric is curcumin. Curcumin has many effects, including anti-inflammatory, antioxidant, and anti-cancer properties, and commonly used to treat conditions like arthritis, digestive disorders, and skin diseases. They also use neem as a Dirakhta indica. They use it also. It has a better taste, and known for having antimicrobial effect, antibacterial, antifungal, and antiviral properties. And they use it to treat skin diseases, respiratory infections, and digestive disorders. They use also a herb called Brahmi. This herb contains compounds called bacosides. They have neuroprotective and cognitive enhancing properties, and it's used to improve memory, concentration, and overall brain function. Ginger also is being used. It contains gingerols and shugols, which have anti-inflammatory and analgesic properties. It's commonly used to treat digestive disorders such as nausea and vomiting. Triphala, another herb or herbal preparation containing different three fruits, haritaki, babitaki, and amla. It's used to improve digestion, boost immunity, and promote overall health. The benefits of individual fruits like haritaki, it has laxative and anti-inflammatory properties. Babitaki has antimicrobial and anti-inflammatory properties. Amla is rich in antioxidants. Okay. Licorice also is being used, and the active constituent of licorice is glycyrrhizine, which has anti-inflammatory, antioxidant, and antimicrobial properties. Has anti-inflammatory, antioxidant, and antimicrobial properties, commonly used to treat respiratory infections, digestive disorders, and skin diseases. Another herb, Chanqa pushpi. This herb contains alkaloids that have neuroprotective and cognitive enhancing properties used to improve memory, concentration, and overall brain function. Gogolo, this is a resinous extract known for cholesterol lowering and anti-inflammatory properties, used to treat conditions such as arthritis, obesity, and skin diseases. Safed mostly also used. This herb contains saponins that have aphrodisiac and immunomodulatory properties. So for aphrodisiac effect, it is used to improve sexual function. Also for immunomodulatory properties, used to boost immunity and to promote overall health. Okay. These herbs are being prepared in different forms. So some are in the form of oils, especially those used in massage. So how they are prepared? They are prepared by infusion of the herbs into carrier oils like sesame oil, coconut or mustard oil. Okay, so they infuse the herbs into carrier oil. So the carrier will have the extract of the herb. They use them for massage, both as preventive and curative measure for various health conditions. Example for muscle stiffness, joint pain, and other musculoskeletal issues. Okay, so can be used also. They rub the affected part of the body, and then they will relieve the condition. They are prepared also as herbal teas, or what we call them decoctions, by boiling the herb in water, the part that will contain the active ingredient, whether root, bark, or seed, until the liquid is reduced and concentrated. And this usually is consumed orally as a tea or used topically as a compress. Some herbs are used as powders. Dried herbs are ground into a fine powder and can be consumed orally, mixed with water, honey, or ghee. Okay, can also be applied topically to treat various skin and hair conditions. Ayurvedic formulations usually prepared using herbs along with ghee, honey, and jaggery. These formulations are used for a variety of health conditions and administered orally. For Unani medicine preparations, they are made from using different herbs and minerals, mostly administered orally for various health conditions. Herbal remedies here usually are administered based on the patient's condition and dosha imbalance. The dosage and duration of treatment are also customized according to individual needs. The use of medicinal plants is often combined with other treatment modalities such as dietary modifications and lifestyle changes to achieve the best results. Okay, so now we go to the opposite direction. We mentioned few herbs and then what is their effect. So if we talk about different disorders, what herbs can be used for management? For example, like digestive disorders, herbs like ginger, cumin, coriander, fennel, and mint are commonly used to treat digestive issues like indigestion, bloating, and constipation. These herbs have carminative and digestive properties that help to improve digestion and relieve discomfort. Okay? For respiratory problem, Ayurvedic herbs like tulsi, licorice, and adatoda, they are used to treat respiratory conditions like cough, asthma, and bronchitis. These herbs have expectorant and anti-inflammatory properties that help to soothe the respiratory tract and promote easy breathing. For skin diseases, they use herbs like neem, turmeric, aloe vera, sandalwood to treat various skin conditions like acne, eczema, and psoriasis. These herbs have anti-inflammatory, antimicrobial, and healing properties that help to soothe and heal the skin. For mental health issues, they use herbs like brahmi, ashwagandha, shankapushpi, and jatamansi. They are used to treat mental health issues like anxiety, stress, and depressions. These herbs have adaptogenic and anxiolytic properties that help to reduce stress and improve mental clarity. Okay? There are also some specific therapies or treatment modalities used in Ayurvedic medicine for various conditions. Like for example, Panchakarma. This is a detox method. So this is a detoxification and rejuvenation method or therapy used in Ayurveda to balance the doshas and remove toxins from the body. They will involve 5 cleansing actions: Vamana, they call it therapeutic vomiting. So there will be induced vomiting to clean or remove toxins from GIT. Verichana, this is purgation, okay, washing the GIT. And then Basti, okay, so if you look at the photos here, Vamana is vomiting. Purgation, purgative effect means, so here Vamana is to clean the stomach mainly, not all the GIT, because vomiting will remove the contents of the stomach. But however, for the rest of GIT, if you take a purgative herb, then it will induce diarrhea and then will clean the intestine. Basti is using enema to clean the colon, the lower GIT. Nasya is nasal administration of medicated oils, to cleanse the nose. And Rakta Mokshana, this is bloodletting, using, for example, leech. Okay, this photo you can see here, this is a leech. So this is the fifth mechanism for Panchakarma. So Panchakarma is detoxification. They use these kinds of maneuvers in order to clean the body, detox and remove toxins, and have been used in the old ages for treatment of poisoning. Okay, this can improve digestion, boost immune system, and enhance overall health and well-being. Another therapy mechanism is called Marma therapy, and this is more like massage. And Marma therapy is energy healing practice in Ayurveda, involves the stimulation of specific points on the body known as Marma points. Same like use of needles in Chinese medicines. You can find also a drawing for the human body, and there are different spots in the human body, and they claim that each spot is connected to a certain organ. So when you stimulate this spot, then you can restore balance and promote healing of that organ. Okay? So these Marma points, they believe that it is connected to the body's vital organs and systems, and stimulating them can restore balance and promote healing. And they use it to treat various physical and emotional conditions such as pain, anxiety, and stress. Okay. Another therapy called hijama or cupping therapy. Hijama actually is Arabic word. Okay. And in English you can say cupping therapy, and this word is being used in many cultures. This is bloodletting procedure, but here it's bloodletting is not induced by leech, or this is a back of a patient, you can see, and then we just induce vacuum and put the cups. They make small wound and they put the cup on top, so the vacuum will withdraw the blood into the cup. Okay, so this is a bloodletting procedure used especially in Unani medicine to remove excess blood and toxins from the body. Actually, it was known among Arabs in the Middle East even before Islam. Prophet Muhammad practiced this one and also advised that hijama to be used. Prophet Muhammad recommended hijama as a method of treatment, means that it is effective, and it is used up till today. The therapy here involves creating a vacuum by placing cups on the skin, which draws blood to the surface. Of course, it will not withdraw blood without inducing some very fine wound. Okay, so you make fine wound so that blood can go out, and then you will help the removal of blood by suction force by the vacuum. It can improve circulation, boost immune system, and relieve pain and inflammation. A lot of research done about hijama even for cancer, helping cancer therapy. Herbal remedies, as we mentioned, we give example already of a lot of herbs that can be used in Ayurvedic medicine. Additional to this, Unani herbal remedies include black seed and licorice. They are used to treat respiratory problems and digestive disorders. Okay, and black seed also is very well known, and this medicine or this kind of seeds was used for treatment even before Islam and during Prophet Muhammad age, and it is among the prophetic medicines, so recommended by Prophet Muhammad also for treatment of diseases. There's hadith about black seed. Yoga and meditation, as we mentioned, it is part of the holistic approach to health and wellness of Ayurveda and Unani, of Ayurveda especially, and they claim that can reduce stress, improve mental and physical health, and balance the doshas. So, by the use of some yoga postures, breathing exercises, and meditation techniques are customized to an individual dosha imbalance and health conditions. So the practitioner will advise or recommend some specific yoga postures, breathing exercises, and meditation techniques suitable for the imbalance of the dosha in this person and to restore it. Now, what's the difference between yoga and meditation? Yoga is mainly that these postures or exercise. But when we talk about meditation, then it is the mind or thought process. So meditation, including focusing on certain issues to improve mental condition and improve the state of mind of the person. So yoga is mainly a physical activity, maybe taking certain postures and relaxation techniques, but meditation including mental techniques to focus on certain issues and improve mental process. Okay, this is the difference between yoga and meditation. The last thing in this lecture is we have to mention that these herbs, although effective, they can treat many diseases, but still we need to know about their adverse effects so that we can decide whether they're suitable for their patient or they may cause some harm. For example, licorice root. It has treatment effects on respiratory system, digestive problems, and so on. But same time, it may cause high blood pressure, low potassium levels, and sodium retention when used in excess for long periods. So, for example, we have to be careful using licorice for patients with hypertension, as an example. Okay. Ashwagandha may cause also stomach upset, diarrhea, and vomiting in high doses. Gogol can cause skin rash, diarrhea, and liver toxicity. Turmeric may cause skin upset and bleeding in high doses, especially when combined with blood thinning medications. So you have to be careful in these populations. Brahmi may cause nausea, dry mouth, and gastrointestinal disturbances in some individuals. Aloe vera can cause abdominal cramps, diarrhea, electrolyte imbalances when taken internally in high doses. Okay? So that's all about Ayurvedic and Unani medicine. Actually, should be adequate for the scope of this course. For those who are interested to read more, we have an examples of additional resources like books and websites and even online courses. So you can refer to if you want to know more about this discipline or this kind of branch of science. Can we have like 5 minutes break, and then we will discuss the second topic. Okay. So our topic now is homeopathy and homeopathy medicines and practices. So what is homeopathy? It is a holistic system of medicine that is based on the principle of like cures like, where a substance that can cause symptoms in a healthy person can be used in a very small amounts to treat similar symptoms in a person who is sick. So what
Doctor,
does yes
the slide is not moving.
again?
The slide is not moving.
Okay. You can see now the second slide.
Yes, doctor.
Okay. So the definition of homeopathy is holistic system of medicine that is based on the principle of like cures like. So, for example, somebody has diarrhea, we can treat him with a medicine that causes diarrhea. Okay, how it comes? We, of course, you cannot use it in a full dosage. The principle here is that this substance can cause that can cause symptoms in the healthy person can be used in very small amounts to treat similar symptoms in a person who is sick. So here will be used in very small amounts, then can be used for treatment. Okay, somebody has drowsiness can be treated by medicine according to this practice that cause drowsiness, but will be given in very small amounts. So this is the principle of like cures like. So the how this practice, this discipline or branch of medicinal practice was developed, who is the founder, what is the history of homeopathy. Actually, when it comes to concept development, how the concept of this treatment was developed, and who is the founder, it was founded by German physician, what you see in this photo, Samuel Hahnemann, who was dissatisfied with the medical practice at his time, in the 17th something, so in the 18th century, okay, to 19th century, and began to explore alternative methods of healing. He developed this principle, like cures like, after conducting experiment in which he ingested cinchona bark, a substance known to cause symptoms similar to those of malaria. Okay, he observed that the substance appeared to alleviate his symptoms and led him to develop the concept of homeopathy. Okay, so he began to practice and teach homeopathy in the early 18 something, means 19th century. And the system gained popularity in Europe and eventually spread to the United States. In the 19th century, homeopathy was widely used in the United States and many homeopathic medical schools were established. However, the rise of conventional medicine and the development of pharmaceutical drugs led to the decline in the popularity of homeopathy in the 20th century. Okay? The key principles of this kind of practice is, as we mentioned, the first one is like cures like. A substance that can cause symptoms in a healthy person can be used in highly diluted amounts to treat similar symptoms in a sick person. Okay? The second thing is, or second principle is individualization. They consider that each person is unique and has their own set of physical, mental, and emotional characteristics, and treatment is tailored to the individual based on their specific symptoms and overall constitution. So the treatment is tailored to the individual based on their specific symptoms and overall constitution. The third principle is minimum dose. Homeopathic remedies are highly diluted to the point where they may not contain any detectable amount of the original substance. So if they don't contact any detectable amount of the original substance, how they are going to produce effect, we will discuss this one in the coming parts of the lecture. The idea is that the smaller the dose, the less likely it is to cause harm and the more likely to stimulate the body's own healing mechanism. The fourth principle is vital force, the existence of a vital force or life force that animates and sustains living organisms. When this force is disrupted, disease can occur. Homeopathic remedies are thought to work by stimulating the vital force and restoring balance to the body. Fifth principle is holistic treatment. Homeopathy views the individual as a whole rather than just a collection of symptoms. Treatment is aimed at addressing the underlying cause of the symptoms rather than just suppressing the symptoms themselves. And a very important concept here that will explain how they claim that these undetectable amounts can cause remedy or can have effect. This is the potentialization principle. This involves the process of diluting and succussing or shaking original substance or potentiating the original substance to activate its healing properties. So there will be a vigorous shaking. They claim that this one will leave the molecules will transfer its energy to the solvent. So even it is very small amounts, undetectable amounts, still it can leave effect in the solvent. And for them, based on this principle, the more dilute the substance, the more potent is believed to be. So it's not there to cause harm, as they claim, but still transferring its energy to the solvent and can have a healing effect. Of course, a lot of people doesn't believe in any of these principles. Okay. Okay. How they are being prepared, these homeopathy medicines, by two steps: dilution and potentialization. They are the key processes involved in the preparation of homeopathic medicines. Homeopathic remedies are made from natural substances such as plants, minerals, and animals. So they keep diluting and shake, keep dilute and shake. So till they reach to a very diluted concentration. So dilution is involving repeatedly diluting the original substance in water or alcohol. Dilutions are done in specific ratios such as 1 to 10 or 1 to 100, where the first number represents the drug or the amount of original substance, and the second number represents the amount of solvent, whether water or alcohol. So you dilute one part of the remedy, for example, in 10 parts of water. One part of remedy, for example, in 10 or 100 parts of methanol. This process is repeated several times, resulting in highly diluted solution. Some homeopathic remedies are so highly diluted that they may not contain any detectable amount of the original substance. However, proponents of homeopathy, those who invented this one or believe in it, they believe that the energetic imprint, this is their explanation, how there is almost no drug or undetectable amounts, and you claim that it will produce effect. So they explain this. They claim that energetic imprint of the original substance remains and can stimulate the body's own healing mechanism. How this is being created? By the process of potentialization. This is a process of vigorously shaking or succussing the diluted solution between each dilution step, between each two dilution steps. After each dilution step, there will be a vigorous shaking, and this is believed to activate the healing properties of the original substance and increase the potency of the remedy. Okay. When it comes to dilutions, they use two expressions for dilution scales, X and C potencies. So they are prepared using different dilution scales, including X and C. They are typically labeled with a number and the letter combination. So if on the label it is written, for example, 30 Cs, or for example 30X or 200X or 200C, what does it mean? This represents the dilution and potency of the remedy. The higher the number, the more dilutions. The higher the number, the more diluted the potent the remedy is believed to. Now, maybe your mind will start to struggle with the concept, because as we know, potent means have more drug. But in homeopathy here, potent means have less drug. So don't get confused. Okay? In homeopathy, when the drug is more diluted, it is claimed to be more potent. Okay? So when we say potent means more diluted in homeopathy only. So X is dilution scale of 10, C is dilution scale of 100. Okay? So What does it mean that it is 1x? Means it has been diluted one time in a dilution of 1 to 10 ratio. Okay? So if 2x, then 2 times. First time we put one part in 10, and then from the first diluted solution, this diluted one, we take one part, we dilute in another time in 10 parts. This is 2x. If you are saying 30x, means this process has been repeated 30 times. Okay? So the original substance is diluted. We say, for example, 6x means that 6x potency means diluted the original substance 6 times. Each time the dilution is 1 to 10 ratio. So 1 to 10, 1 to 10, 6 times means you have 10 zeros. We have 6 zeros, means 1 million. So the final potency will be 1 part per million. 1 part per million. If you dilute 10 times, then you have to put 10 zeros. Okay? This will be 1 part in 10 zeros parts. This is the potency. The C is 100. So if you say, for example, 6C, then you put 12 zeros. Okay? Because each time we dilute 1 in 100. So it will be 6 zeros. Okay? And dilution will be in water or alcohol, as we mentioned. These are the common solvents used in this medicinal practice. When it comes to who is using X, who is using C, the X potency is more frequently used in United States, while C potency is more frequently used in Europe. Okay? Higher potencies like 30C, 200C believed to be more potent and have a deeper action on the body's vital force, while low potencies often used for acute conditions or in cases where a mild or gentle action is desired. Because like this diluted will have amount of drug and then it will produce some symptoms, but will be mild symptoms because still also diluted too much. The choice of potency and dilution scale depends on the individual patient and their specific symptoms and constitution. Homeopathic practitioners will often choose a potency and dilution based on the patient's level of vitality, sensitivity, and susceptibility to the remedy. Okay, so as we explained, what is the role of succussion or potentialization in the preparation of medicines? This one is a key process involved in preparation of homeopathic medicines. Involves, as we mentioned, vigorous shaking or pounding of the solution between each dilution steps. It is believed to activate the healing properties of the original substance and increase the potency of the remedy. Nobody saw that. Nobody detected this by any physical means. So it's their claim for this method or the way they explain how does it work. They claim that this shaking will release the energy of the substance and transfer it to the solvent. So the solvent will becomes imbued with the medicinal properties, means have or gain the medicinal properties of the original substance. So even the dilution reached to that almost there is no drug there, but its energy is still in the solvent and can produce healing effect. Okay, so the one who is believing or practicing this medicine, the proponents, believe that this potentialization or succussion creates a dynamic energy within the remedy, can stimulate the body's own healing mechanisms. It is believed that the energy of the original substance is transferred to the water or alcohol solvent and then to the patient's body when the remedy is ingested. They also claim that this process will create a unique signature for each remedy that is distinct from the original substance. Means that even the print of or energy print of this substance when diluted and then shaken vigorously in the solvent at each step of dilution is even different from that of the original substance. And believed to be that this signature related to energetic pattern of the substance as is thought to be responsible for the healing properties of that remedy. Okay? So between each two dilution steps. How long, how vigorous will be this potentialization or shaking or the strokes? It can vary depending on the remedy and dilution potency. In general, they believe that the higher the potency, the greater the number of shaking that is used to prepare the remedy. Shake it more, you make it more powerful. This is what do they believe. Okay, this is potentialization or succussion is a key part of homeopathic medicine making process and believed to be responsible for the potency and effectiveness of homeopathic medicine. Okay, so what are the types of homeopathy medicines? There are mother tinctures, there are triturations, and there are LM potencies. So there are several types of homeopathic medicines, including mother tinctures, triturations, and LM potencies. Mother tinctures, they are concentrated herbal extracts used as the starting material for many homeopathic medicines, prepared by macerating the fresh or dried plant material in a mixture of alcohol and water for a period of time. Then suppose that alcohol and water will extract the active ingredients from that herb. Water usually will dissolve water soluble ingredients. Having alcohol in the mixture will help to dissolve water insoluble ingredients. Then they will filter, they remove the fibers and unwanted materials of the herb, and they take the solvent with the active ingredients extracted in it. Okay? And they will dilute the resulting solution. Triturations, they are prepared by grinding the original substance, usually a mineral or metal, with lactose powder. This is the trituration. They grind the usually used for minerals or metals. They will grind them and they mix them with lactose powder. The grounding process is repeating many times till the substance will become completely blended with the lactose. This powder is then diluted and will be succussed to create a homeopathic remedy. The LM potencies, they are type of homeopathic remedies that involve a very high dilution, typically 1 to 50,000 or 1 to 100,000 dilution, that is succussed repeatedly between each step. LM potencies are believed to be specifically useful for chronic conditions and for patients who are sensitive to higher potencies. Okay? So higher potencies, then you have more zeros here, right? Okay. So these are often taken more frequently than other potencies, with the remedy being dissolved in water and taken in small amounts throughout the day. Each type of homeopathic remedy has its own specific method of preparation and is used for different conditions and types of patients. The choice of remedy and potency depends on the individual's patient's symptoms and constitution and is determined by a trained homeopathic practitioner. So, what kinds of herbs or minerals are used as homeopathy medicines? And what are the references being used also for recommending or for knowing the suitable one? So, number one, for the selection of medicines, there are two processes, repertorization and materia medica. So, number one, first they need to do the repertorization, which is identification of patient symptoms, constitution and medical history, and then they used for selection of remedies. Selection will be using the materia medica that lists the herbs or minerals and their effect. Both of them are essential tools in the selection of remedies. They provide a comprehensive understanding of each remedy, unique qualities, and help practitioners to choose the remedy that is best suited for each patient. Okay, so as we mentioned, repertorization is to know the condition of the patient. It is a systematic method of analyzing patient symptoms and finding the most appropriate homeopathic remedy. Okay, A repertory is a reference book that lists the symptoms associated with each homeopathic remedy. So, the homeopathic practitioner analyzes the patient's symptoms, refers to the repertory, and finds then what are remedies that are most likely to be effective for the patient condition. Materia medica, then, as we mentioned, is containing a list of the herbs or material or minerals. They have description and characteristics, description of the characteristic symptoms of each of these remedies. Okay, so it provides detailed information about the origin of the remedy, the symptoms it is most effective at treating, and the types of patients that are mostly likely to benefit from it. So same like, for example, the drug info handbook that you have nowadays that will list drugs and then their their mechanism of action, their indications, their effects, side effects, and so on, and what treatment or and the indications, what diseases they use to treat. So this is the materia medica for homeopathy. Okay. But then for repertorization or repertory, this is a more like medicine book. So it will help you you identify the symptoms. You refer to this one, it will help you to describe the condition, identify the problem, and will suggest the remedy to treat these conditions. Okay? So these are examples of some herbs or other remedies used in homeopathy. For example, arnica. This is commonly used for injuries, trauma, and shock. It's often used after surgery, childbirth, or dental work to help reduce the pain and swelling. Some of the indications of arnica include bruising and swelling after injury, soreness and stiffness in muscles and joints, headaches after a head injury or concussion, fear of being touched or approached after an injury or trauma. Belladonna is also used, commonly used for fever, inflammation, and acute illness. It's often used to treat sudden intense symptoms that come on quickly. Some indications for belladonna include high fever with a red, hot face and dilated pupils, sudden intense headaches with throbbing pain, inflammation of the throat, tonsils, or ear canal, restlessness, and agitation with fever. Nux vomica is also being used. It's commonly used for digestive disorders and stress related symptoms, often used for patients who have a history of overindulgence in food, alcohol, or drugs. Some indications for Nux vomica include irritability and impatience, especially in morning, indigestion with bloating, constipation, or diarrhea. Can treat anything, constipation or diarrhea, the opposite things. Headaches and back pain that are worse in the morning, difficulty sleeping due to stress or overwork. Ignatia also is commonly used for emotional and mental health issues. It's often used for patients who are grieving or experiencing emotional distress. Some indications for ignatia include mood swings and sudden changes in emotions, anxiety and depression with weeping and sighing, difficulty sleeping due to emotional stress, hysterical or nervous behavior in response to emotional triggers. Okay, so these are examples of herbs that have been used uh, very diluted in homeopathy. So when it comes to the dosage and administration of homeopathy medicines, how this is being decided? The dosage and administration of homeopathy medicines depends on various factors such as patient's age, overall health, severity of the symptoms, the type of remedy prescribed, and the general guidelines are that potency is determined, okay, or selected based on the severity of the symptoms and the sensitivity of the patient. Frequency depends on the severity of the symptoms. Acute symptoms may require more frequent doses, while chronic conditions may require less frequent doses. When it comes to potency, as we mentioned before, usually for acute conditions will be less diluted. For other conditions, not acute, then it will be more diluted, means more potent. Okay. For the dilutions, As we mentioned, it is diluted in water and alcohol before administration. This is done to increase the efficacy. Administration, they are taken in different forms like tablets, pellets, liquid drops, or powders. The remedy should be taken orally, and it is recommended to avoid touching the remedy with your hands. The dosage of the remedy depends on the potency and severity of symptoms. For acute conditions, a single dose may be sufficient, while chronic conditions may require repeated doses over a longer period. Okay? Okay, safety and precautions with homeopathy medicine. There are some risks that are included, like, for example, allergic reactions are possible to one of the ingredients in the remedy. Some adverse reactions may occur if, in case, of course, usually this is very diluted and it's not supposed to produce any effect, but in case of wrong preparation, then they may cause some adverse reactions. Okay? So, because they are highly diluted, usually they are generally safe. And because there is too much doubt regarding the efficacy of this kind of treatment modality, it's not advisable that this one will be used as a replacement for conventional medical treatment at all, especially for serious or life-threatening condition. So, if they are being used, they will be used only as a complementary therapy alongside conventional treatments. Okay? Okay, now we talk too much now during this lecture. Many times we doubt. You can notice this from the way I talk, how this one is very diluted, almost no molecules remaining in the solvent, how it is going to produce effect. They claim about energy and whatever, print and so on, that will be transferred to the solvent. What is the evidence on this one? No evidence. Have not been detected by any physical means. Is there any evidence for this kind of medicinal practice? Okay. So, there may be some evidence, some studies that mention that this one is effective. However, there is also some criticism about the methodology of these studies. Okay? So, for example, the evidence, there are clinical studies. Some clinical studies have found that homeopathy is effective in treating certain conditions like allergies, arthritis, and irritable bowel syndrome. How does it work? Nobody knows, probably by producing, for example, some, what they call it, that methodology that used for desensitization. We call it desensitization, by introducing small amounts of the material that will produce allergy, then the body will get used to it and then will lose the sensitivity towards it. Okay. But the problem are these studies are criticized for their methodology, sample size, no rigorous scientific standards like how did you diagnose the disease, how did you measure the effect, whatever. So they are not strong studies that that are reliable, produce reliable results. When it comes to patient satisfactions, there are many reports about patient satisfaction with this kind of treatment. But this, if you can say that patient took this kind of treatment and they are satisfied, means that this produce effect. No, there is some criticism for this one. We'll explain when we talk about the evidence against. And then when it comes to historical use, have been used for more than 200 years in many parts of the world. Still, this is not also. They say that this one is long time being used, so it's well established. No, still there is criticism and there is evidence against homeopathy. Number one, there is lack of scientific evidence. Despite of this long history, and it is widespread use in Europe and US, there is little scientific evidence to support the effectiveness beyond the placebo effect. Second thing is lack of plausibility. Homeopathy is based on the principle that like cures like, but this is not consistent with the scientific understanding of how medicines work. As we know that medicine is supposed to work by attaching to certain receptors producing certain biomedical changes or biochemical changes that will reverse the pathogenic process. So this principle of like cures like that doesn't produce any theory or any evidence from metabolic processes or physiology of the body that can prove this. The third evidence or against homeopathy is when it comes to dilution. Dilution of homeopathic remedies is so extreme that almost sometimes will be no molecules remaining in the solvent, so doesn't contain an active ingredient. So how does it work? Talking about energy is cannot be believed because it has no evidence. The other criticism is about adverse effects. While homeopathy is generally considered safe, there have been reports of adverse effects, particularly when they are used in place of conventional treatments for serious conditions. Okay, so there is also another very important claim is about the placebo effect. Okay, so you cannot say that this one produce effect because this medicine, since produce effect, it must be effective because there is well-known effect called placebo effect, and maybe this is the main effect that has a role in homeopathy. Placebo effect, as we know, is a phenomenon where person experiencing a perceived improvement in their condition after receiving a treatment that is inactive or has no therapeutic effect. Means that you produce a tablets that contains only excipient, doesn't have any active ingredient. Somebody, for example, feeling depression, you give him this tablet and you convince them that it's very effective for treatment of depression. They are going to have this placebo effect. Maybe their condition will improve and the depression will be relieved. Okay, so and this effect is well known, and placebos are often used in clinical trials as a control group to compare the effectiveness of new treatment against a placebo. Okay, so mostly this homeopathy of very highly diluted substances trigger the body natural healing mechanism by placebo effect. Okay, this through the placebo response in those patients. The response is thought to be related to the patient's belief in the treatment. They come to the doctor, the homeopathic doctor or practitioner, they believe that this treatment is going to produce effect, so it will produce the placebo effect in them. Okay? So this is the end of the topic of homeopathy. Do you have any questions?